Meet Thea, a busy mum of two. Unfortunately, she has been complaining of back pain for a while, and it has started to heavily impact her life. She is definitely not alone. It has been shown that female caregivers who experience back pain also experience a decline in quality of life. The impact can be far-reaching, extending to work, such as more common absences, and family life, such as an increased emotional stress on their spouses and children. Thea decided she had had enough, so she organised a meet-up with her OT friends to see if they could help. They suggested that in the days before the meeting, she should think of any repetitive activities she does. Let's see if we can spot any. Oh, I think we found our culprit. That was one of multiple lifts she had done this morning. Let's see if we can analyse the movement. First, she eccentrically contracts her erector spinae to flex her trunk. She begins to flex at her glenohumeral joint and extend at her elbow and wrists. Then she begins to flex at her knees. By leaning so far forward and bending her knees so late in the descent, she moves her centre of gravity outside of her base of support, causing both a decrease in stability and a need for the erector spinae to support most of her body mass. Slight dorsiflexion occurs at the ankles. As she begins to ascend, she extends at her knee and hip joints. Lifting the majority of the mass is her erector spinae concentrically contracting to extend her trunk. As she continues to hold summer away from her body, her centre of gravity remains outside of base of support, resulting in her back extensors having to work overtime to maintain her balance and upright posture. Also, muscles such as the anterior deltoid and flexor carpi radialis work isometrically to maintain flexion of the glenohumeral joint and prevent ulnar deviation. As she rotates her trunk to the left, she further increases the pressure on the lumbar spine. Her left internal obliques and right external obliques contract to achieve this movement. It's no surprise that Thea has been suffering from back pain, as now we can see how much pressure is put on her lumbar spine when she's lifting. Again, she is not alone. Vincent and Hocking found that it was common for mothers who completed a multitude of daily lifting activities to also complain of lower back pain. Let's see if those OTs can help. Luckily, they knew exactly what to do and quickly jumped in with some easy adjustments for Thea's lift. The first thing they did was make sure Thea's centre of gravity remained within her base of support as she completed her lift. This can be achieved by squatting, or otherwise commonly known as bend at the knee. The primary joints used for this movement are the hips, knees, and ankles. In this lifting position, it is her strong knee extensors and hip extensors eccentrically contracting to control the squat. Once fully descended, she only slightly needs to flex her trunk to pick up the object. This decreases the pressure on her lumbar spine via both decreasing the activation of her erector spinae and lowering the shearing force. To bring the object to her body, she used her elbow flexors and glenohumeral joint extensors. As she rose, it was her knee and hip extensors and plantar flexors which worked concentrically to create the movement. The OTs make sure to tell her that she needs to hold her baby close to her body. This decreases the time her arm muscles need to be activated and keeps her centre of gravity within her base of support. Whilst in this standing position, and if holding her baby, Thea is told to make sure to keep her knee slightly bent. This decreases the lordosis of the spine, thus again decreasing the pressure on the lumbar spine. The OTs jump in just as Thea rotates, and lets her know that this is a very dangerous movement. It increases the compression of the lumbar spine, heightening the possibility of vertebral disc-related injuries, such as a herniated disc. Because her OT friends are so great, they suggested some other things she could do to help with her back pain. These suggestions included sleeping with a pillow between her knees,
This would help maintain a neutral position of her spine and prevent it remaining rotated as she slept. Also, it would be a great idea for Thea to look into some strengthening exercises. This is made even more important for new mothers as pregnancy hormones such as relaxin can still have an effect post-delivery by weakening joints, ligaments, and muscles. In particular, core muscles such as the transverse abdominis should be targeted. Muscles such as these play a large role in spinal stability and protection whilst reducing lumbar pressure. Pilates would be a great way for Thea to strengthen these important postural muscles. Finally, they suggest some stretches, such as the one you're seeing right now, targeting the iliopsoas muscle. If tight, these can contribute to lower back pain as they pull the pelvis forward into an anterior tilt, increasing the lordosis of the spine. Thea is delighted with all these suggestions and can't wait to put them into place. Just look at that beautiful lift. Now we can end our story by meeting Thea, a busy mum of 2 who is no longer suffering from back pain.
To be free.